Hi, I'm Lionel Lubitz. It's hard to believe that 50 years has passed since graduation from the University of Cape Town. My overwhelming sensation is one of intense and immense gratitude. I'm grateful to the university for giving me a superb start to life in medicine, such excellent training in the practical delivery of care to the patients that eventually came my way. I had to teach myself the art of medicine that became such an integral part of how I practice pediatrics. I also learned how to understand and overcome prejudice and bigotry from my years at the university. I'm immensely grateful for the friends that I went to university with, who remained my friends throughout the university and over the decades subsequently. They have taught me how to be a better friend and a more considerate human being. I'm so grateful to my Swiss wife Rita, who picked me up while hitchhiking in Greece in 1974, welcomed me into her combi and sleeping bag, and gently taught me how to love unconditionally. That was sometimes a struggle from the time that I started, but I did learn on the way. I'm so grateful for Australia for giving me a home, and a massive thanks to the Royal Children's Hospital in Melbourne, where I worked for over 40 years and where I learned how to be a better paediatrician. I'm grateful to my children, Lara, Jessie, Emily, Adam, and their spouses, Ari, Leo, Harry, and Julia, for teaching me how to be a better parent and human being, especially, of course, when it comes to the patriarchy. And of course, my grandchildren, who have nourished me beyond belief. I'm grateful to being born on this fragile planet at a time in history when the science of medicine exploded. Wars evaded me personally, despite the chaos that persists in the world. So thank you, Irv, Jake, Bernie, Alistair, for facilitating this gathering, and I'm only sorry that I cannot be there, as it coincides with the week of my first grandson's bar mitzvah, which I can't miss. I hope to see you all at the 60th reunion and wish you well in the celebrations ahead and good health in the time we have left.
Hi, this is John Penman, recording a little video for my ex-classmates of that wonderful year of medical school, final year, 1972, on our 50th anniversary. I'm not going to try and tell you a whole lot of stuff. I'm sitting here in my little study. There behind me is my Mac, retired. Just thought that probably people would be more interested in just looking at a face and saying, oh God, look how old he looks now, etc., etc. So hope you all have a wonderful time. Hope maybe we can actually have some interaction over the event through Zoom or whatever, and wishing you all the very best in the rest of our somewhat diminishing lives at this stage. Best to all. Bye.
Hi, greetings from Oxford. This is Tony Bradlow, living quietly on a side street near the centre of town with my wife Jean, to whom we've been married for 46 years. We have 3 children and 4 grandchildren, of whom we're duly proud. And I've been a consultant rheumatologist and physician at the Royal Berks Hospital down the road in Reading for the last 38 years. I gave up clinical practice a year ago. I'm still working there in various capacities, mentoring, appraising, etc. Difficult to retire. What else can I tell you? I don't want to do any anecdotes. I'm a bit concerned about that. Those tend to fall flat. They tend to be boring or offensive, so I think I'll steer clear of that if you don't mind. But I wish you all the best for the reunion, and enjoy life, and I hope to see some of you at least when we come to Cape Town in February 23, hopefully. All the best.
And our group was at the PMH, Peninsula Maternity Hospital, which was, of course, in that wonderfully vibrant community that used to be District 6. And I think Janet may remember it and Ken may remember it because you were in my group. It was early on, and in the PMH, you walked in and there was a big sort of waiting area which had benches around the side. And then there was a little ante-room off it where the obstetric registrar was giving us a tutorial, and we used to sort of take it in turns to catch babies, the deliveries, and it was my turn. It was very early on. It was the first one. I hadn't had one yet, okay? And the registrar was sitting in the ante-room sort of facing out, and we were all sort of, locked into his every word. And he, suddenly behind us, we heard this voice saying, "Doctor, ek wil druk." And of course, the registrar, I won't name him just in case he's, around, but he was called Eric. He's had typically sort of obstetric, "Don't worry, darling, we'll be with you in a moment," and carried on. I think also he was trying to impress the women in our group. Our group consisted of myself, Ken, Lee Napier, Richard Stern, Lionel Lubitz, but also Janet and Leslie Schumann and Shirley Popilski and Carol Marshall. Now, I wasn't wearing a miniskirt, so he wasn't checking out my legs. Anyway, it's sort of all quietened down again. An obstetrician could tell you why. Maybe she became less agitated all of a sudden. And Eric carried on with the tutorial. And then suddenly, a couple of minutes later, she jumped up and, "Doctor, ek wil druk." And Eric, to the midwife, "Come on, guys, please, just the nurse is coming. Don't worry, you'll be fine, okay?" And then it calmed down again, inexplicably. But then the third time, and this was happening over my shoulder, and I looked over my shoulder. This time the dialogue had changed slightly. She said, "Doctor, ek gaan druk." And fellow classmates, she drukt, hey? And this baby just shot out. I promise you, it just shot out, hit the floor at an angle, and had sufficient, fortunately at an angle, had sufficient lubrication to sort of slide across the floor and come to rest gently against the skirting board under the bench. And of course, suddenly there was a flurry of activity, and a couple of midwives appeared with clamps and, the placenta, this, that, and the other. I actually got to deliver that placenta, and it was credited my first catch, my first delivery. And as you can imagine, what do you think that little baby? It was a very nice, full-term, live-born, male, well-grown delivery. What do you think he was doing? He was screaming his head off. And basically, I think he was absolutely fine. I actually managed to keep tabs on him for a couple of months, and certainly by the time he was 2 or 3 months old, he seemed absolutely fine. Do you remember, Janet? And so, yeah, that was my anecdote. That was my introduction to obstetrics.
This is a period when I was doing pediatrics, and I was doing